Chicago, a vibrant city known for its stunning architecture and bustling economy, surprisingly hides a darker reality: rising homelessness, drug crisis, and violent crime. Despite its gleaming culture, tent camps sprawl under bridges, opioid overdoses surge, and shootings plague neglected neighborhoods. The city's progress contrasts sharply with these deepening crises. So, what's driving Chicago's struggles, and can it find a way forward? Let's dive deep into today's video. Hold up, smash that like button, share it with your friends, and hit subscribe so you don't miss what's coming next. The latest point-in-time pit count from January 2024 shows a huge jump in homelessness in the city, with 18,836 people recorded as unhoused, compared to just 6,139 in 2023. That's a massive increase, and experts say it's mostly because of two big factors: an influx of migrants coming from the southwest border, and the end of pandemic-related support programs that were keeping people afloat. But when looking at the bigger picture, the Chicago Coalition for the Homeless used 2022 data to estimate that a staggering 76,375 Chicagoans experienced homelessness at some point in 2024. That's way more than the point-in-time count captures, showing just how widespread the issue is. Over the last 2 years, thousands of asylum seekers have arrived in Chicago, many with nowhere to go. This has put even more pressure on an already strained system. Then there are the economic struggles. Skyrocketing rent inflation and the end of COVID-era financial aid have made it harder for people to stay in shelters. And let's not forget the deep-rooted disparities. Homelessness hits extremely low-income households the hardest, with Black and African American communities facing the highest rates.
We build genuine relationships and connections with people and help people who have fallen through the cracks of the larger system.
The city is trying to tackle the crisis with support services. Departments like Family and Support Services and Housing are working to provide shelter resources and stability for those in need. But advocates say it's not enough. They're pushing for more affordable housing funding to make a dent in the problem. Chicago isn't alone in this. Across the U.S., homelessness shot up by 18.1% in 2024. But Illinois saw a shocking 116% increase. And most of that was right here in Chicago. It's clear this is a growing crisis, and without major changes, the numbers might keep climbing. Chicago is still struggling with a serious drug crisis, especially when it comes to opioids like fentanyl. But there's some good news. Recent data shows a sharp drop in overdose deaths, suggesting that the city's public health efforts are starting to work. In 2024, Cook County reported 1,026 confirmed opioid overdose deaths, a 43% decrease from the 1,822 deaths recorded in 2023. Hundreds of cases are still waiting for
fentanyl here, ready to be sent up north to the US, where their value is more than $500,000. But this amount of fentanyl is enough to kill a whole city.
While fentanyl is bad enough, a new threat has emerged: medetomidine and opioids, two powerful animal sedatives now being mixed into street drugs. In 2024, Chicago saw over 160 suspected cases and 12 confirmed overdoses linked to this deadly combo. The scariest part is that naloxone Narcan doesn't work against that combo, leaving first responders and users with fewer ways to treat an overdose. The crisis isn't hitting everyone equally. Men make up 76% of overdose deaths, and the hardest hit age group is 50 to 59-year-olds, accounting for 27% of fatalities. Racial disparities are also stark. Black Chicagoans represent 53% of overdose deaths, showing how deeply systemic inequities play into this crisis. Research shows a troubling bidirectional relationship between homelessness and drug use. Each fuels the other in a vicious cycle. Drug use can lead to job loss, financial instability, and ultimately homelessness, while the trauma, stress, and instability of life without stable housing often drive people towards substance use as a way to relieve stress. Limited access to healthcare, safe shelter, and mental health support only deepens this crisis, making it harder to break free from addiction while unhoused. Studies also reveal that homelessness itself can be a risk factor for starting drug use. The harsh realities of life on the streets, exposure to violence, untreated mental health conditions, and social isolation increase the likelihood that someone will turn to substances. Early experiences of homelessness, especially among youth, are strongly linked to later drug use, highlighting the urgent need for housing-first solutions and preventive support to disrupt this dangerous pattern before it takes hold. The city isn't sitting back. The Chicago Department of Public Health, CDPH, has rolled out several harm reduction strategies, including free Narcan kits at all 81 public libraries and in vending machines across the city. Operation SOS, which is a 10-week outreach blitz targeting West Side neighborhoods with high overdose rates. The MAR Now program, which offering same-day addiction treatment, free rides to clinics, and telemedicine support, and community partnerships with over 50 groups to track overdoses and coordinate responses. Luckily, between June and August 2024, emergency medical services responses for opioid overdoses dropped by 23% compared to the same period in 2023. That's a big win, but with new drugs like medetomidine hitting the streets and racial disparities still glaring, the fight is far from over. Chicago's making progress, but the crisis demands even more action, and fast.
A lot of violent confrontations between patrons. I've seen a man repeatedly struck with a wooden chair. I have seen patrons fighting in larger groups of 5, 6, 7 patrons fighting.
Inside the library.
Inside the library.
For the first time since 2019, Chicago recorded fewer than 600 homicides in a year, with 572 in 2024, down from 615 in 2023. That's a step in the right direction, but the city still has a long way to go. Shootings also dropped 7% fewer incidents and 4% fewer victims compared to the previous year. Even robberies showed improvement, with December 2024 marking the 5th straight month of declines. Despite these decreases, there's a big concern that only about 1 in 7 violent crimes led to an arrest in 2023, leaving many offenders unaccounted for. This weak clearance rate undermines public trust and makes it harder to sustain long-term reductions in crime. The toll of gun violence isn't spread evenly. Black neighborhoods continue to bear the brunt of shootings and homicides. Groups like the University of Chicago Crime Lab are working on solutions, but systemic inequities in policing resources and economic opportunity keep fueling the cycle. Not stopping that, Chicago is known as the most gang-populated city in the U.S., with an estimated 15,000 gang-affiliated individuals spread across more than 100 gangs. In 2023 alone, gangs were linked to over 1,800 reported crimes, including more than 20% of the city's homicides. Notable groups like the Black Disciples and Four Corner Hustlers continue to be active, often involved in violent crimes, such as drug trafficking and robbery, contributing to ongoing safety concerns across many neighborhoods. A newer and growing threat in Chicago is the Venezuelan gang, Tren de Aragua, which has been expanding its presence in the city. This gang is involved in serious crimes, including drug and human trafficking. Their arrival has created rising tensions with local gangs and communities, especially as law enforcement and social services work to respond to the related challenges. The influx of migrants connected to Tren de Aragua has also strained resources and heightened fears of increased gang violence. The Chicago Police Department, CPD, is adopting new strategies to combat crime more effectively, including strengthening partnerships with community groups and faith-based organizations to rebuild trust and proactively prevent violence, while also investing in programs that address underlying issues like poverty and limited economic opportunities, shifting the focus from reactive policing to long-term solutions that tackle the root causes of crime.
It was at the January meeting at which they said, well, we hear you about working panic buttons and surveillance cameras in every branch, but it's going to be 2 years until we can fulfill the panic buttons, and it's going to be 5 years until we can fulfill the surveillance cameras. That's not acceptable.
Chicago's heading in the right direction, but serious hurdles remain low. Arrests, persistent disparities, and uneven enforcement threaten progress. To keep crime trending down the city needs smarter policing, real community investment, and policies that address inequality at its core. The gains so far show it's possible now, it's about making them last.
Adults should be able to engage in consensual sexual activity without government interference. And people who are being coerced and trafficked and forced through violence to engage in sexual activity, that's a crime and it should remain a crime.
Adults should be able to engage in consensual sexual activity without government interference. People who are being coerced, trafficked, or forced through violence to engage in sexual activity, that's a crime. Prostitution in Chicago is a complicated issue affected by changing laws from the authorities' unfair enforcement and increasing calls for reform. Since Illinois reclassified prostitution as a misdemeanor in 2013, arrests have plummeted by 97%, reflecting a shift toward decriminalization. However, enforcement remains lopsided. 90% of arrests still target sex workers, while buyers and traffickers face little consequence, according to the Chicago Alliance Against Sexual Exploitation, CASE. This imbalance keeps vulnerable individuals trapped in cycles of criminalization, while doing little to curb exploitation. The Chicago Police Department CPD maintains public databases tracking prostitution-related arrests, offering insight into enforcement patterns. Meanwhile, recent police stings, like a Cook County Sheriff's 2024 operation that arrested 10 buyers, show some effort to hold demand-side participants accountable. Yet raids on massage parlors, such as an April 2024 Evanston bust, leading to 4 women's arrests, highlight how low-level workers, not traffickers, often bear the brunt of enforcement. Illinois lawmakers are considering new protections, including a 2025 bill banning police from sexual contact with people they investigate, a step toward preventing abuse of power. Advocates push for full decriminalization, arguing it would reduce violence, stigma, and police harassment, while improving sex workers' access to health care and legal protections. Groups like the Dreamcatcher Foundation, founded by trafficking survivors, provide exit programs, mentorship, and health services to help women leave the trade. But without more funding for housing and job training, many will struggle to survive. While Chicago has moved toward less punitive approaches, true progress requires ending the criminalization of sex work, shifting focus to trafficking prosecutions, and expanding social services for those seeking alternatives. Until then, the city's policies will keep perpetuating harm against marginalized communities. Another serious concern is that homeless individuals in Chicago face severe healthcare disparities, with chronic conditions and early mortality being widespread. According to a 2024 report from the University of Illinois, Chicago UIC, people experiencing homelessness in Illinois died nearly 20 years earlier than the general population, with most deaths linked to chronic diseases, mental illness, and substance use disorders. From 2017 to 2022, deaths among the homeless rose sharply, with a 36.6% increase since the start of the COVID-19 pandemic. Over half of homeless individuals reported needing medical care, but being unable to access it due to cost, transportation barriers, or long wait times. Many suffer from untreated conditions like cardiovascular disease, diabetes, respiratory illness, and untreated room visits rather than preventive care. Homelessness often leads to severe health issues due to poor nutrition and inadequate hygiene. Without regular access to healthy food or proper sanitation, individuals become more vulnerable to infections and chronic conditions. Additionally, pre-existing illnesses like diabetes and heart disease tend to worsen without consistent medical care. Mental health is also significantly affected, with higher rates of depression, schizophrenia, and other psychiatric disorders. Substance abuse frequently increases, as individuals may turn to drugs or alcohol as a coping mechanism. Moreover, those experiencing homelessness face greater exposure to violence and sexual assault, further compounding their health risks. Moreover, life expectancy among homeless individuals is drastically shorter compared to the general population. The harsh living conditions increase the risk of death from exposure to extreme weather, untreated illnesses, and infectious diseases. Suicide rates are also higher due to the psychological toll of homelessness, along with the elevated risk of fatal violence. Without stable shelter and protection, homeless individuals remain in constant danger, leading to premature and preventable deaths. Homelessness creates significant barriers to essential services, including healthcare, education, and employment opportunities. Many homeless individuals struggle to obtain medical treatment due to a lack of insurance, transportation, or documentation. Education and job training become inaccessible, perpetuating the cycle of poverty. Additionally, securing government benefits or even basic identification documents can be extremely difficult without a permanent address, further limiting their ability to reintegrate into society. The daily struggles of homelessness lead to immense emotional and psychological strain. Constant stress from uncertainty, trauma from past experiences, and the struggle for survival take a heavy toll on mental well-being. The loss of dignity, social isolation, and overwhelming hopelessness contribute to a deep sense of despair. Without adequate support, many find it difficult to recover from these psychological wounds, making it even harder to escape homelessness. Women experiencing homelessness in Chicago encounter especially dire health challenges. A 2023 community survey showed that nearly 70% of unhoused women lacked health insurance, and over 80% reported untreated mental health issues. Many also face trauma from domestic violence or sexual assault, which remains largely unaddressed. Healthcare services offered through programs like the Chicago Department of Public Health, the Lawndale Christian Health Center, and mobile outreach clinics have tried to fill gaps, but demand far exceeds available resources. Furthermore, about 1 in 3 homeless individuals reported being refused treatment or receiving substandard care due to stigma, reinforcing distrust in the system. Structural barriers like lack of identification, unstable housing, and the digital divide limit their access to Medicaid enrollment or telehealth services. Programs such as Healthcare for the Homeless, HCH, federally funded clinics, and street medicine teams are essential, yet currently underfunded and unable to meet citywide demand.
We need to close those loopholes. We need to increase child labor fines because companies aren't feeling enough pain when they violate the law.
Chicago continues to grapple with serious issues related to child labor abuse and displacement. Cases of child labor trafficking have come to light in recent years, including a 2024 conviction of a woman and her 2 daughters who forced 2 undocumented West African children, aged 12 and 14, into labor in suburban Chicago. In another case from 2023, a suburban couple received prison sentences after pleading guilty to similar trafficking charges. These incidents reveal the hidden but persistent problem of child exploitation in the region, often targeting undocumented or vulnerable youth. Such cases highlight the need for stronger monitoring and enforcement mechanisms to prevent child labor and trafficking in both domestic and informal settings. Child abuse and neglect also remain widespread and deeply concerning. In 2019, Cook County alone reported over 2,900 cases of abuse and neglect, with 35 child deaths directly tied to caregiver actions. Statewide data from 2022 showed over 31,000 substantiated cases of abuse and neglect, reflecting a troubling trend across Illinois. Alongside this, child displacement due to housing instability has had a major impact on family and child welfare in the city. Since 2010, Chicago has seen a sharp decline in its child population, about 4,000 fewer children, particularly in low and moderate income neighborhoods. This drop is linked to public housing demolition and rising housing costs, which have displaced families and interrupted children's access to stable education and community support. The combined effects of abuse, labor exploitation, and housing insecurity create a vulnerable environment that requires comprehensive community-driven solutions to protect and uplift children in Chicago. Children experiencing homelessness in Chicago often face frequent school changes which disrupt their emotional, social, and academic development. According to a national survey, 13% of students in kindergarten through 8th grade changed schools 4 or more times over 8 years, with homelessness being the strongest predictor of such instability. These repeated transitions contribute to high absenteeism, poor academic performance, and increased vulnerability to social stigma and bullying. Without consistent schooling, children fall behind their peers, making it harder to catch up and succeed in the long term. Organizations like Chicago Hopes for Kids work to provide educational support, but systemic solutions are needed to ensure stability for homeless students. The instability of homelessness can lead to significant developmental delays in children. Research shows that homeless children often experience lags in language development, motor skills, and social-emotional growth. More than half of homeless preschoolers exhibit at least one major developmental delay, which can have lasting effects on their learning and behavior. The constant stress and lack of a secure environment also disrupt the formation of healthy attachment relationships, further impacting emotional regulation and social interactions. Early intervention and stable housing are critical to mitigating these delays and helping children reach their full potential. Homelessness increases the risk of family separations, including placements into foster care. In Illinois, Black children are disproportionately affected, making up nearly 3 times their share of the state's population within the child welfare system. Many of these separations stem from issues tied to poverty and housing instability, rather than direct abuse or neglect. Such disruptions strain family bonds and make reunification more difficult, perpetuating cycles of instability. Advocacy groups like the Shriver Center on Poverty Law highlight the need for policies that address housing insecurity as a way to reduce unnecessary family separations and keep vulnerable families together. Addressing homelessness is essential to protecting children and families from its far-reaching consequences. Stable housing, consistent education, and comprehensive support services can help mitigate developmental delays, academic disruptions, and family separations. By prioritizing housing stability and equitable access to resources, communities can foster better outcomes for vulnerable families and break the cycle of homelessness. Chicago's unhoused population faces heightened risks due to long-standing issues of police misconduct. Reports of excessive force, unlawful detainment, and discriminatory policing disproportionately affect homeless individuals who are often targeted for simply existing in public spaces. The notorious Homan Square facility, described as an off-the-books interrogation site, raised alarms about due process violations, a particular concern for unhoused detainees who lack legal support. Between 2019-2023, Chicago spent over $164 million settling police misconduct cases, yet homeless residents remain vulnerable to harassment and unjust treatment while struggling to survive on the streets.
Real estate has a very important job. They are the gatekeeper of housing. They get to decide where families live, where they work, and where their children go to school.
Systemic housing barriers actively push more Chicagoans into homelessness. A landmark 176-case discrimination complaint exposed how landlords illegally reject housing choice voucher holders, a policy that traps low-income residents in homelessness. Meanwhile, despite Illinois' Homeless Bill of Rights, multiple municipalities criminalize survival behaviors like sleeping outdoors, creating a cruel cycle where poverty becomes punishable. Crime-free housing ordinances have further weaponized evictions against vulnerable tenants, with minor lease violations rendering families homeless. These practices demonstrate how housing policies themselves drive homelessness rather than solve it. For over 13% of homeless students who change schools multiple times, educational disruption compounds trauma. Chicago's homeless children face developmental delays at twice the rate of housed peers, while systemic failures like Chicago Public Schools' Title IX violations create additional barriers. Without stable housing, students struggle with attendance, academic performance, and social stigma, perpetuating intergenerational poverty. From police violence to discriminatory housing policies, Chicago's human rights failures hit homeless residents hardest. Real solutions require treating housing as a fundamental right, not punishing its absence. Investments in affordable housing, tenant protections, and trauma-informed services would do more to address homelessness than decades of criminalization have achieved. Until then, marginalized communities, especially the homeless, will continue paying the price of systemic neglect. Chicago's ongoing Title IX controversy has particular consequences for LGBTQ+ youth experiencing homelessness, a population already at heightened risk. When conservative groups challenged Chicago Public Schools' transgender-affirming policies in March 2025, they targeted protections that many unhoused LGBTQ+ students rely on for safety. For youth rejected from their homes due to gender identity, schools often become their only safe space, making policies on facility access and confidential support life-saving. The discrimination faced by Black LGBTQ+ employees at Hostess's Galewood factory reflects systemic employment barriers that disproportionately impact marginalized communities, including those experiencing homelessness. For unhoused transgender individuals seeking employment, discrimination often creates impossible catch-22s. They face bias when job hunting without stable housing, yet can't secure housing without employment. Illinois' legal protections mean little without consistent BTQ+ protections. On paper, enforcement gaps leave many behind, especially those navigating homelessness. Organizations like Brave Space Alliance do critical work supporting unhoused trans individuals, but systemic solutions require addressing intersecting crises, lack of affirming shelters, employment discrimination, and education to working opportunities for LGBTQ+ youth. True equity means ensuring protections reach those most vulnerable, not just those with stable housing. Homeless encampments in Chicago have raised significant environmental concerns, particularly regarding waste accumulation and sanitation. Don't forget to like, share, and subscribe for more hard-hitting stories. See you next time.